Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Rita Espinoza, who is our Chief of Epidemiology at San Antonio Metro Health, and this is our COVID-19 update. Today's weekly vaccination report shows that 779,689 individuals have received at least one dose of the COVID-19 vaccine, and 504,499 people are fully vaccinated. We continue to exceed both state and national averages, and with that said, I am happy to announce that Bexar County has administered over 1 million vaccine doses here in our community. That's very good news. One of those doses was given to me this weekend, and I'm very glad for that. I want to say a very big thank you to our San Antonio Metro Health team, along with the San Antonio Fire Department and the volunteers who were at the Alamo Dome doing a great job for our community. As a reminder, people ages 16 and up can now go to the Alamo Dome or to the Wonderland Mall on a drive-up basis from between 2 p.m. and 5 p.m. or until capacity is reached to receive the COVID-19 vaccine without an appointment. An estimated 300 vaccines will be available at the Alamo Dome for patients who arrive without an appointment, so we want to encourage you, again, to go get a vaccine wherever it is available. We have plenty of supplies now on hand. Remember that you can also subscribe for our vaccine alerts by texting vaccine or vacuna to 55000. On to our COVID-19 update tonight. We are reporting 119 new cases of COVID-19, which brings the total to 213,677. Our 7-day rolling average is now 172. Our positivity rate, according to our progress and warning indicators, is now at 2.2%, and indicators remain steady at this time. I'm very pleased that this community continues to work together to protect one another, and our positivity rate now remains the lowest among major metros in the state, and that has been true for the entire month. So congratulations to everyone who's out there protecting one another from this disease. Fortunately, today we have no new deaths to report. Please, as always, keep those who have lost loved ones in your prayers tonight. We've lost too many of our friends and family and neighbors to this disease. We want to remember those who we've lost. There are 236 COVID-19 patients in our local hospitals tonight, and over the last 24 hours, there are 23 new admissions. 93 patients are in the ICU with COVID-19, and 38 are on ventilators. Let me turn it now to Judge Wolff.
Well, overall, the numbers look good. It's still somewhat of a mixed bag. If you look back to April the 3rd, as we came out of the terrible things we faced this winter, we got down to 176 people in the hospital. Now, just 16 days later, we're up to 236. That means 60 more people have entered the hospital, in the hospital now than we had back 16 days ago. And we kind of thought some of this would happen when the governor took away all safeguards, that we would see things begin to change again. So we've seen some. I mean, it's not a spike. It's not something that, is way overboard, but it is a little bit of a concern. And adding to that concern is the fact that at least with University Hospital, we're beginning to see a drop-off on people wanting vaccinations. Last week, we had another good week. We vaccinated 34,200 people, but there's still, this week, I think we're only going to do about 4,000 today, and half of those were the second shots. So there's a lot of people out there that still have chosen at this particular time not to get a vaccine. Just to give you an idea of how widespread that is, at our University Hospital, we got about 9,000 employees, Bexar County Hospital District, and 81% have chose to get a vaccine, but that means that there's 19% that didn't. That means there's about roughly 1,700 and some odd employees that chose not to get it. Now, if they're healthcare workers and haven't decided to get it, and others out there that may be younger, thinking that, hey, if I get it, I'm not going to get too sick. I might not get sick at all. But it's still a very dangerous situation. And so we really encourage you to get the shots, regardless whether you're young or whether you're older. But we need to do that if we're going to protect them. It's a lot better protection than if you had COVID before and maybe you haven't built up the antibodies that you need. If you've had it and you're not sure of that, it doesn't hurt to get the shot. So for weeks and weeks, we were pleading for more vaccines. Now we are pleading with you that we have the vaccines. We're pleading with you, please go get your shot.
Thank you, Judge. And again, as we've stated, the American vaccine approval process is the most rigorous in the world, so it is safe, it is effective, and it will save your life. So please do go get a vaccine. I do now have a frequently asked question we're going to ask of Dr. Espinoza. So the question tonight is it possible to contract COVID-19 in between your vaccine doses?
Yes, it is possible. Remember that you don't get protection immediately after getting the vaccine. It takes about 2 weeks for your body to build that immune response. So if you get exposed during that time, then you could contract the illness and still come down with COVID. Even after that 14 weeks, remember the first dose, you're not 100% protected, only about 80%. So there is an opportunity for you to still become exposed and develop signs and symptoms with a COVID. Now, some people will say, well, do I need to get that second dose? And the answer is yes. And when you would get that dose is once you have recovered from your illness and you're out of isolation, which is usually 10 days from your onset, and that you're no longer having fever, where you're fever-free for at least 24 hours without the use of medications, then you can go for that second dose. And it is recommended that you get that second dose.
Thank you, Doc. And I'd like to also share an update on our blood supply, which continues to face challenges. Last week, you might remember that the South Texas Blood and Tissue Center was urgently calling for blood donations because they needed 200 additional donors per day, which amounted to 600 a day doses. 600 donors a day that they were needing in total. The total inventory is moving in the right direction. They're now at a 2.5-day supply, but the supply is still critical. More progress needs to be made to reach the recommended 7-day supply. The supply of type O blood, which is used in trauma and emergencies, is up slightly, but it is still critical. So at just over a day's supply, we still need you to make an appointment and give blood if you are able to. You can make an appointment at southtexasblood.org or by calling University Hospital at 210-358-2812. And as always, if you've been struggling through this pandemic, paying rent or mortgage, the city and the county have worked together to put together an emergency housing assistance program. You can access that assistance by calling 311 or going to the website covid19.sanantonio.gov. Also, if you're out of work and without an income and would like to train for a job that's available in our community today while you receive a stipend to make ends meet, you can get more information by calling 311 or enroll at 210-224-HELP. As always, thank you so much for continuing to do your part to protect yourself and your family from this disease. Continue to wear your mask, practice social distancing and proper hygiene. Do it for yourself, do it for San Antonio, and do it for your community. With that, Dr. Espinoza, myself, and the judge are available for questions.
As the vaccine becomes more readily available in our community and as more providers offer shots, is the demand for the mass vaccination sites dropping, and do you anticipate closing the mass sites anytime soon?
So we have, at the Alamo Dome, we have appointments booked out to May 1st, and we will be obviously working to fill additional appointments as they become available. I mentioned earlier that from the hours of 2 to 5 between Tuesday and Saturday, if you have a desire to get a vaccine and don't have an appointment, you can just drive up and you can get one at that time. We need folks to go get their vaccines, and we'll keep the facilities open as long as they're needed.
You know, even though we've dropped to 4,000 from as high as about 7,000, that's still quite a few vaccines we'll be doing at Wonderland and at the Robert B. Greene Hospital. And at the Wonderland Mall, we have 2 levels. We have the top level and the bottom level. If it really continues to fall off, I mean, I think we would probably size down some, but I don't think there's any plan to leave.
Just on that same topic, Judge, with you mentioning that people are not getting the vaccine, are we increasing the outreach on the county or the city side to encourage people to get the shot?
I don't know if we're doing enough or not, but we really do need to encourage everybody to do that.
sending out community health workers to areas where we see that vaccination rates aren't that high. We're also trying to do some outreach clinics in those areas too, where individuals may have difficulty coming to the dome. And so we'll continue those efforts and continue the education and the outreach to ensure that all those that are capable and able to get vaccinated.
And remember, as the vaccine started to roll out, we were urging patients as we were going through the eligibility criteria, but 16 and up now are fully eligible, and now we have supply available. So the message has shifted to get your vaccine, get it as quickly as you can, there's appointments available.
There were a lot of people that were reluctant to get it, certainly at the front. In fact, didn't get it and refused to get it, but I think we're seeing at least some people that were adamantly opposed changing their mind and beginning to get it now, because people are still dying and people are still getting very sick and people are getting in ICU, people are getting on ventilators. Everybody thinks it's not going to happen to me or one of my loved ones, but you never know when that might happen. And I think most of us have seen that, at least with relatives and close friends.
Are the major vaccine hubs in San Antonio showing any signs of the vaccine hesitancy, such as a falling demand for appointments?
Yeah.
We still see the demand in appointments. So at the Dome, we're still giving between 2,500 to 3,000 a day. So I don't think it's necessarily vaccine hesitancy, but it might just be that there's more opportunities and more availability at different locations, so individuals go wherever they can to get it as quickly as possible. As the mayor and the judge state, we still encourage individuals, anyone who is 16 and above and they want it, don't wait. Don't say, oh, I'm going to wait till my older family member gets it. No, now is the time for you to go ahead and get that vaccine.
We're seeing more people that booked not show up, and of course that could mean they changed their mind or they could have got it somewhere else too.
What has been the response to San Antonio's vaccine wait list, and how many people have signed up so far?
I was told by Dr. Bridger a little bit earlier, we've had almost 3,000 people sign up, and they all have been booked for appointments at this point. So there's some demand there, but again, you don't need to go on the registry at this point. You can just sign up for an appointment.
COVID-19 hospitalizations in San Antonio have increased 32% over the past 2 weeks, even as transmission remained relatively stable. What can this be attributed to? The spread of variants, perhaps?
Well, you have to remember that when we say, 2-point-something% now, that's of people that got tested. I don't know. Well, I know our testing's gone down some. I don't know how much. And there are a lot of people that, are not chosen to get tested. I don't know, Rita, you may have some other explanation for that.
You want to say anything?
Well, I'm pleased to add on, because I think the issue of the variant probably deserves some clarity, but there's clearly more activity going on, and so with more activity there's going to be more transmission if people aren't wary and wearing their masks and doing what they can to protect themselves. And that's, while most people are, I'm sure there's transmission happening, and we will see it in our caseload, which we were starting to see a couple of weeks ago, and the hospitalizations are the trailing indicator, and that's what we're seeing now. I think it is just another indicator that we can start to do things, but we still have to be cautious and protect ourselves to the best extent we can, and that includes wearing masks and go get a vaccine when you can.
Yeah, and as far as the variants, we're not seeing that the hospitalizations are necessarily due to the variants. We haven't seen an increase in that characterization. But again, individuals, if they're ill and they get diagnosed out in the community and they're not being seen by a physician, we still strongly encourage individuals that as they start to see any symptoms or any signs that things are getting worse, so difficulty breathing, shortness of breath, having trouble walking from one room to the other, that they seek that medical attention as soon as possible. Because typically what we see is the individuals try to maintain at home and then end up at the hospital when their symptoms are so severe.
The jury is now deliberating in the George Floyd trial. Is the city of San Antonio preparing for possible protests?
So I met with the police chief this afternoon to discuss our preparations. There has been no intel on activity related to the Chauvin trial, but San Antonio Police, as other departments, will be prepared in the event that there is.
The Sheriff's Department is preparing also. As you know, we had several protests around the courthouse, all of which were handled very, very well and conducted well. The sheriff did a great job, nobody caused any problems there, but they are getting ready on security if it's needed. You may recall the only real problem, we didn't have a problem with the protesters. The only problem we had was a bunch of thugs that ran downtown one night and knocked out a bunch of windows, and I don't think that had anything to do with the protests. They were just not good people.
And Mayor, with that, since we're not expecting any unrest, I'm assuming that is your hope that we don't see that here.
That is my hope, sure. But we have to be prepared for contingencies, and we will. And it's very likely that people might see some additional visibility. But again, to emphasize, we don't have any intel on activity. We don't expect it, but we'll be prepared if it does happen.
Another quick question. Off topic of COVID, with the migrant children at Lackland. I know this is being handled by the feds, but do we have any indication why there was a need to open up the space and the housing at Lackland?
Well, they're going to take, I believe, up to 375. I think the first 100 are getting there now, and there are young boys just like we've got out at the Bexar County grounds. They are 13, 14, 15, 16, 17-year-olds. I don't know overall. I know there's still a problem at the border, and I would assume that they're having to open more centers to be able to handle the ones that come across. I think it's important that we understand this. I think the president made a mistake of allowing all of them in at one time. But again, you need to remember, they are here legally. They came across, turned themselves in, and they do have a right to an asylum hearing. That's part of the Constitution. That's part of law. They do have a right to that. And so we have to do things to try to help accommodate them until we can get them with a family member or get them with an organization such as St. Peter, St. Paul to handle it. It's not something we all chose to do. But we need to try to do the best to protect these young boys.
And correct me if I'm wrong, Judge, but wasn't the notion that we weren't going to move to Lackland unless we were at capacity at Freeman?
Well, we're getting close to capacity. We're 1,900 and some odd right now. I think our capacity limit was 2,100.
Okay. The only other question, Mayor, we all saw your guns over the weekend, as you alluded to, getting your first shot. Any reactions to your first shot? How do you feel?
I feel great. I mean, I will admit there were some emotions involved with seeing the vaccination card, knowing how much we've all been through this year and what it's taken to get to the point of having a vaccination card. But I feel great. A little bit of tenderness at the infection site, but it was very easy, painless, very quick. And total professionals from our fire department to our Metro Health team and the volunteers that are there. Please go do it yourself.
That's all we have tonight. Thank you.